Good afternoon, everyone. Am I audible, please? Once again, please confirm. Hello, good afternoon.
Good afternoon, sir.
Okay, yeah, greetings from the Department of Public Health Dentistry, Institute of Dental Sciences, Shiksha Anusandhan University, which is deemed to be university in Bhubaneswar. Okay, with due consent from our Dean, as she is preoccupied with some of the official duties, she has asked us to proceed with today's program. So myself, Dr. Ramesh Nagarajappa, who is an professor and head on behalf of our Department of Public Health Dentistry, welcome one and all. And I express my sincere gratitude to our Dean for providing us this opportunity and the platform for conducting this 6 days workshop on systematic review in the form of webinars. It gives me an immense pleasure to welcome the resource persons, our fellow colleagues from the Department of Public Health Dentistry, Terna Dental College, Navi Mumbai. Dr. Romi Jain, Dr. Nikhil, and Dr. Vaibhav Aras are with us today for the program. I heartily welcome them, and I also am glad that they have accepted our invitation with a short notice. And I appreciate that they are sparing their time for us, for my students and our faculty, to share their knowledge on the essential topic, which is the systematic review along with meta-analysis, which probably tops the list in the hierarchy of evidence in research designs. Special thanks also goes to Dr. Shishir Singh, the Dean of Terna Dental College, who has allowed and encouraged and even promoted and finally permitted the young team to be with us. So thanks to him. Please convey my thanks to him if in the later stage. Okay. So some of the objectives of this webinar, which I have thought on my own, okay, maybe our speakers will be able to justify or add up more on this. So first we need to assess the need of doing systematic review and meta-analysis. Then to understand the basic principles of conducting the systematic review and meta-analysis. To appreciate the advantages of this design over the other research designs. And finally, I thought that it will enhance the skills of writing systematic review manuscripts. So this is what I have thought of. So hope my students at the end of this webinar will be able to get sensitized enough and they develop the inquisitiveness to practice writing the systematic reviews. The schedule is planned on a, okay, for a 6 days. So day 1 to 6, in between we have a Sunday wherein we will be off taking a break on that day. So day 1 will be, the speaker will be Dr. Nikhil Banushali. So he'll be speaking on the introduction to evidence-based practice and systematic review, the protocol writing, which includes the title, focus questions and objectives, the PICO guidelines, along with the inclusion and exclusion criteria. So this is what will be covered in day 1. So day 2, we will be having Dr. Romi with us, and she will be speaking on the search strategies. Is it not audible? Am I audible now?
Yes, sir.
Yeah, sorry, Nikhil, again, once again, I'm extremely sorry for this.
No problem, sir.
Okay, again, I have to share the screen. Yeah, okay. So I'll be continue. Yeah, day 2, we will be having Romi Jain, who will be speaking on search strategies. Now, am I audible still? Is it okay?
Yes,
Yeah, fine.
yes.
Yeah. So
Perfect.
on day three again, Romy Jain will be talking about the selection of articles with Prisma flowchart and the data extraction process. So the fourth day will be by Dr. Nikhil again, and he will be speaking on the risk of bias assessment along with quality assessment. And the final 2 days will be occupied by Vaibhav, and he will be speaking on assessing a systematic review article using Prisma checklist and protocol writing for Prospero. So this is how we have scheduled the program. And sorry, yeah. So with the permission of the chair, we have already wasted so much of time. So we would like to continue. So we'll start off with the proceedings by introducing our speaker for the day, Dr. Nikhil. So he is currently working as a reader in Terna Dental College. He has completed his BDS from SMBT Dental College in Sangamner from 2010 and MDS from Pacific Dental College in 2014. He has around 20 international and national publications to his credit. He has been awarded for excellence in public health dentistry at International Excellence Awards in 2018. He has been awarded by Cancer Patient Aid Association and WHO for the support to the cause in 2018. And he's also been associated with the IDA, wherein the IDA fellowship programs are being conducted, and he's one of the faculty in that. Okay. So I personally feel proud and take the pride to introduce him because he was one of my student who has passed his post graduation under me. So I'll be moderating the today's session, and if any of the participants have any questions for discussion, we will take up at the end. They can just type in the chat box, and I also request the participants. We will be providing one email ID in the chat box. You can just send your mail ID along with phone number such that the link can be shared for the future days. Okay. So, Dr. Nikhil, you can take over. I wish you all the best.
Thank you, sir.
Yeah.
So can you make me the host?
Yeah, fine. 1 minute. Making the board. It's not going down. My laptop is better. Yeah. This one I'm not used to. Yeah, make it. Okay. Yes, Nikhil.
Yes, sir.
Yeah, is it okay now?
Yes, yes, sir.
Yeah. Yeah, start. You come and add here.
Yeah.
Oh.
So is the slide visible?
Yeah, yeah, slide is visible. Yeah, it's visible, Nikhil.
Yeah. Can I request everybody to mute their mics? Okay. So a very good afternoon to one and all present here. So today we are going to take a lecture or a webinar on systematic review. And before starting, I would like to thank uh, the Dean of the Institute of Dental Sciences, my guide and my mentor, Dr. Ramesh Nagarjappa sir, and I would like to thank him for inviting us and giving us the opportunity to conduct this 6 days webinar series on the topic systematic review. I would also like to thank the management of Siksha Vanusaj. I would like to start this topic. So let us see what all things will be covered today. So we'll start with the history. Then what is systematic review? What is meta-analysis? What is evidence-based practice? What are the steps in systematic review? And what are the different types of questions? How do you frame the question? What is the PICO model, or basically what is PICO? And how do you write the inclusion and the exclusion criteria? Yeah. To start with the history of systematic reviews, we all know this person, James Lind. So he's among one of the person who also started with a proper clinical trial. He was a doctor assigned for the naval officers. So he found out that vitamin C was responsible, or the deficiency of vitamin C led to scurvy. So he was the first person who wrote a article which was like a systematic review, and he labeled it as a treatise on the scurvy, a critical and chronological view of what has been published on the subject. So after that article, he quoted that it became requisite to exhibit a full and impartial view of what had hitherto been published on the scurvy, and before the subject could be set in a clear and proper light, it was necessary to remove a great deal of rubbish. So at that time, he understood the importance of systematic reviews, and he conducted one systematic review. So basically, what he did was, there were various studies that were conducted on scurvy and vitamin C. So after going through those studies, he finally came up to a conclusion, and then he published a paper. There are some participants waiting. I'll just admit them in. Then the next person is Carl Pearson in 1904. So Pearson analyzed the effectiveness of typhoid vaccine from 5 studies of immunity and 6 studies of mortality. What amazed him was the irregularity of the data. So he was amazed by looking at 9 different studies. All 9 different studies had different kinds of data. So this is considered as the first analysis of clinical trials using what is later known as meta-analysis. Then came this person, a very important person, Archie Cochrane. In 1974, Archie Cochrane and colleagues made analysis of the use of aspirin in the prevention of heart attacks, that is myocardial infarction. This became one of the most influential systematic analysis in randomized control trial. In 1979, Archie Cochrane wrote, "It is surely a great criticism of our profession that we have not organized a critical summary by specialty or subspecialty, adapted periodically of all relevant randomized control trials." Okay, so now after the history, we can clearly make out that what is the importance of systematic reviews. Okay, now right now also it is the need of the hour. That is why all of a sudden now the hype of systematic reviews has increased, and most of the universities are now asking, instead of library dissertation which was done earlier, now they have asked their students, the PG students, to do the systematic review. Now, why this importance has increased? Because now there is so much literature available, but it is not properly sorted. So now it is the time to stop doing some primary research, or you can continue doing the primary, but it is also important to start doing some secondary research. Yes, so the systematic reviews are a kind of a secondary research where you do not have to go to the field. You have a lot of literature available on the databases. You have a huge library. You can go and assess the articles, and you can sit on your desk and complete the entire systematic review. Yeah, so now what is exactly a systematic review? So it focuses on a specific question, or what you call is a focused question. So a systematic review, it uses explicit pre-planned scientific methods to identify, select, appraise, and summarize similar but separate studies. So it has a proper specific methodology. Unlike the review, the literature review, or the narrative review that we have been doing all these years, since our BDS times, in even the third year, final year, we have done some reviews and we have presented in some of the conferences. All those were reviews. Now let us see what is the difference between a systematic review and a narrative review. Before that, we will just have a look at a definition quickly. So, a systematic review is defined as a review of evidence on a clearly formulated question that uses systematic and explicit methods to identify, to select, and critically appraise relevant primary research and to extract and analyze data from the studies that are included in the review. The methods used must be reproducible and transparent. Yes. So we have understood the four main steps here are: you first identify the articles, okay? You then select the articles, you critically appraise the articles, and then you extract, okay? So apart from these four steps, which are not there in the narrative review, there is also one more important thing over here. Now, what do you mean by it has to be reproducible and transparent? Is that when you take a certain topic, suppose you have taken a topic on e-cigarettes, okay, or smoking and lung cancer, or teledentistry, or maybe COVID-19 or coronavirus. So what you start writing a review, and you create your own hypothesis there, and you keep writing the review, and you try to find articles to support your hypothesis. Okay, so there is a lot of bias in narrative review. Whereas in systematic review, there is a proper methodology and you cannot do that. There is a proper standard format in systematic review. So if two people are conducting a systematic review on the same focused question, if you have a focused question and I am doing the study and if you are doing the same study, okay, so eventually what will happen in the end, we both should get the similar results. So that is the reproducibility of the systematic review, which is not there in narrative review. Okay, so there is a lot of bias in narrative review. It has no standard format, no clearly specified methods of identifying, selecting, and validating included information. You just go to the library, you take out some journals, you read some papers, and you start writing the article. Okay, and quantitative synthesis, which is done in systematic reviews, is not done, or very rarely you see those quantitative synthesis in a normal narrative review. Now, what is meta-analysis? We have slightly, I think the basic concept we have understood about these systematic reviews. Now, what is meta-analysis? Meta-analysis is nothing but next step of systematic review. So every meta-analysis will be a systematic review, but every systematic review cannot be a meta-analysis. Yeah. So Glass in 1976, Genevieve Glass, he defined meta-analysis as the statistical analysis of a large collection of analysis results from individual studies for the purpose of integrating the findings. And then came the alternative definition by who? 1988, which I personally find a better version of the old definition, because if you read the definition, it states that a statistical analysis which combines the results of several independent studies considered by the analyst to be combinable. So now this definition is more specific because it states that not all systematic reviews can be translated into meta-analysis. Not in all the systematic reviews you can do the statistical analysis. You need a homogeneous data. When you have a homogeneous data, then and then only it can be translated into meta-analysis. So the second definition is more appropriate. Now, in this diagram, you can see all the reviews are not systematic reviews. All the systematic reviews can be called reviews, and only some of the systematic reviews can be translated to meta-analysis. Now let us have a look at what is evidence-based healthcare, or what is evidence-based dentistry, or evidence-based medicine. So here we have three main components in this. It is the integration of best research evidence. Second is clinical expertise and patient values. So this definition was given by Sackett in 2000, where it is a combination of these three things. You need a proper evidence, you need clinical expertise, and also patient values. What the patient wants has also to be considered. So this hierarchy of evidence we all are aware of. So as I told you, the hype of systematic review has increased because you can see it is on the topmost position. The systematic reviews and meta-analysis are on the topmost of the hierarchy of the evidence. There are a lot of this activities going on lately, all the webinars that are going on, all the programs that are going on, even workshops have been conducted on clinical uh, dental clinical skill development and all. Various full mouth rehabilitation programs and all such activities are going on. We do attend those programs, but still you can see the in the hierarchy of evidence, it ends up at the last stage, that is your expert opinion. Expert opinion is a good thing, but along with that, you also need to assess the articles. Now, which type of article you need to assess? If you go above, you have case series and case reports, but the best ones are systematic reviews. So, if you are trying to do something new in your clinical practice, you can go through the systematic reviews. In a systematic review, there might be 8 studies, 10 studies, compilation of various studies, and in a matter of about some time, you will be able to understand and come to a conclusion quickly. So systematic reviews are the most reliable. Yeah, systematic review is the most reliable type of study design. So there are a few more people still joining. I'll just add them. Okay. Now, why this systematic review? Where does this systematic review in lie? It lies in this knowledge translation from clinical research to practical decisions. So first thing that you do is a primary research. A primary research would be observational studies. Okay, a primary research would be interventional studies, randomized controlled trials. So from there, you generate the evidence. Once the evidence is generated, you synthesize this evidence in the form of systematic reviews. Okay, so there are various databases. One of the main and the most common and significant database is the Cochrane collaboration. So you will find a lot of systematic reviews over there, and from those systematic reviews, you have the clinical policies or the guidelines that are laid down by the professional societies. So now on the coronavirus or the COVID thing, there are so many guidelines that are coming up, but still there are not many systematic reviews that have been conducted. So that is why there are a lot of changes day by day in those guidelines. So once a systematic review is conducted, the picture is more clearer. Okay, and then the foundation of the guidelines or the guidelines are laid down more appropriately. Now, what are the steps of systematic review? Yeah, so the first step, background search, but I would recommend the first step to be formation of a team. To conduct a systematic review, you need to have a team. In that team, you need to have one expert, a subject expert or the content expert. You need to have that person in your team. Okay, and then you do your background search. Now in background search, there is something called as scoping review. Okay, which is very important. Without that, you won't be able to formulate your question. So you need to do that scoping review. The scoping review is nothing. The difference between systematic review and scoping review is that there is no need to do a extensive search strategy for scoping review. You randomly search articles, you go through various articles, and then you frame a question. Then there is no quality assessment needed in a scoping review. Whereas in systematic review, you need a quality assessment done. In scoping review, sometimes it may take a lot of time. It may take 6 months, 12 months. It may take that much time also. It depends on the topic. The broader the topic, the more time it will take for you to do the search. Okay. And so the first step is you form a team, you do a background search, then you form a research question or what is called a focused question. Then you set criteria for inclusion and exclusion. Then you go to the search strategy. Once you build a search strategy, okay, so which will be explained in the next lectures. Now in today's lecture, you will understand some of the things. Some of the things will be continued in the next lecture. But now some things, everything cannot be covered in this lecture, but definitely you will understand in the coming lectures. Everything, all the steps are covered in the future lectures. Yeah, so you build a search strategy. Once you have built the search strategy, You have established an inclusion criteria. Based on that inclusion criteria, you select the what you have searched. You present a Prisma flowchart. Articles for your focused question. Now you have to narrow down. You have set some inclusion criteria. You will narrow down, and you may come down to 100 articles. You may come down to 50, or you may come down to 10 articles. That depends upon the broadness or how much narrow you want your question to be. Okay. Once that is done, then you start doing the quality assessment. So for quality assessment, there are various scales that are present. Okay. So through that scale, we will rate the article. So the rating of the article is very, very important. Even though the article is of low rate or of poor quality, you still include that article in the systematic review, but we are mentioning. But when you're doing a meta-analysis, then we have to do some kind of sensitive assessment for the meta-analysis, and then we have to see whether that article has to be included or no. Again, those things will be covered in the later lectures. Then you do the data extraction and analysis. You synthesize the results, you draw the tables, and you synthesize the results, and then you publish. And one more thing that can be done in a systematic review is that you can update your systematic review. Once you have done a systematic review, after a few years, 2-3 years, maybe there would be more 4-5 articles. You can add those articles and give an update of your systematic review. Yeah. So now we come to defining the question and developing criteria for including the studies. So these are some key points. A clearly defined and focused review begins with a well-framed question. In Cochrane reviews, questions are stated broadly as review objectives and specified in detail as criteria for considering studies for this review. The review question should specify the types of population. Your question should include these 4 components: population, that is your participants; types of interventions, that is your I; and comparison C; and the types of outcomes, that is your O. So this is your PICO model, which consists of these 4 elements: population, intervention, comparison, and the outcome. Cochrane reviews should include all outcomes that are likely to be meaningful and not include trivial outcomes. Outcomes that are of very less importance should be excluded, and the primary outcomes should be limited to a very small number and include adverse as well as the beneficial outcomes. You are doing some systematic review on some randomized control trials. Apart from the beneficial effects, you also need to mention the adverse effects, okay, in your protocol. Cochrane reviews can focus on broad questions or be more narrowly defined. We will come to that. What is a narrowly defined question and what is a broad question? Yeah. Now, before you frame a question, you first need to know what are the different types of question. You have to classify the question types. Okay. So you may come across different types of questions. So the first one here is, what proportion of the population is newly diagnosed with this problem each year? So that is a incidence, because there are new cases. So this is an incidence type of a question. What proportion of the population is currently living with this problem? That is a prevalence type of question. What should be done to treat this problem? Therapy question. Will detecting this problem early before the symptoms make a difference in my health? That is a screening type of question. How good is this test at detecting my problem? That is diagnostic accuracy. What is the likely outcome of this problem? That is a prognosis type of question. Will there be any negative effects of the intervention? That is a harm type of question. What causes this problem? That is a etiology type of question. And how can this problem be prevented? This is a preventive. Now, why do you need to know the types of question is, with the help of this, you will be able to decide which type of study designs you will be including in your systematic review. So this is a very, very important step. Generally, what we do is we go through the previous literature, we go through the previous systematic reviews that have been done. We just see how they have framed the question, and then we start framing the question based on that. So that is okay to start with. That is a good thing. But if you're doing something novel, something different, then this guideline will help you. Okay. Yeah. So now these are some of the examples for the types of questions. Now, the first, incidence and prevalence. What is the incidence or prevalence of dental caries in school children of rural areas as compared to the urban areas? Therapy or prevention question will be, what is the effectiveness of antibiotics in preventing complications such as post-operative infections after the third molar extractions? For screening, is Tolidin blue test to detect oral cancer effective in reducing mortality? Diagnostic accuracy, how useful is a periapical radiograph in detecting interproximal caries? For prognosis, are the patients with diabetes at higher risk of experiencing complications after third molar extractions than are patients without diabetes? Harm or etiology, does giving toddlers milk instead of water to drink at night cause caries? So now you can see here the different types of examples and different types of questions, that is incidence type, prevalence type, therapy type, prevention type. So now we will see what study designs correlate to what type of question. Okay, so now when you want to know the incidence or prevalence of something in your systematic review, you will try to find or include studies. You need to include study in the inclusion criteria. You need to mention what type of study designs you are going to include in your systematic review. So when you want to know the prevalence of dental caries, suppose in India, and you compile all the articles, so mostly all the answers you will get from surveys. So you will include cross-sectional studies. And when you want to know the incidence, you will have to include cohort studies, because to know the new cases, you need to have longitudinal studies or long-term studies, which are the, so for incidence, best is the cohort study. For therapy and prevention type of question, if you are looking for some therapy, okay, or prevention of something, definitely you will have to go for randomized control trials. For screening, again, randomized control trials. For diagnostic accuracy, you go for randomized control trials, but due to ethical considerations, sometimes it is difficult to get randomized control trial in these cases. So for example, if you want to test the efficacy of or the efficiency of CBCT, so you cannot expose the patient for your study, which may harm the. So what you do, you take some cross-sectional studies which have been done on the OPG, on the CBCTs that have been already taken. So you may go for retrospective studies also over here. For prognosis, again, clinical trials and cohort studies. Prognosis cohort studies, because you need to see the prognosis, long-term prognosis. If you want to see the success rate of the implants, then you will have to include your cohort studies in your systematic reviews. In the inclusion criteria, you need to have cohort studies, because similarly for harm also, to know the harm of a particular thing or the failure of a particular thing, it's again a long-term thing. In clinical trials, we mostly have follow-ups maximum up to 1 year. Mostly they are up to 3 months, 6 months, or 1 year. But to know the harm or know the success rate of a particular thing, you need to conduct a long-term study, and that will be seen only in cohort studies. And finally, we come to etiology. Etiology is purely analytical type of study design. That is why you include both cohort studies and case control studies. That is your cause and effect. Yeah. So the same thing that was there in the table, it is, you can see in the form of this pyramid. So you have the study designs and the levels of incidence. So for randomized control trials, they answer the therapy and diagnosis questions. If you are not able to find randomized control trials for your focused question, then you move down to the pyramid to the next best option. Okay. And then next you have cohort studies. But first, for therapy, you will always look for randomized control trials only. If they are not there, then you move down to the cohort studies. Cohort studies, they help us to answer prognosis, etiology, and harm type of question. Again, if you do not find them, then you move down and you go to case control studies. If you can't find a cohort study to answer prognosis, etiology, harm, use a case control study. But there is a lot of bias in case control studies, so it is always preferable to include randomized control trials and cohort studies in your study, in your systematic reviews. Okay, if and only if you don't find them, then you go to case controls, case series, and case reports. So these are the last things that you would opt for: case series and case reports and your laboratory studies. If there is no evidence no human trials done, no clinical trials done, then definitely you can also conduct a systematic review of in vitro studies. Okay. Now we have seen different nature of the nature of the question. What we saw, the classification or the types of, that is the nature of the question. So in addition to that, we must identify the main components of the question. So the main components, as I have told you already, that is your PICO, population, intervention, comparison, and your outcome. So population is the patients relevant to the question. Intervention is the treatment or prevention strategy or possibly the harmful exposure of interest, and comparison is the management strategy used as a reference against which to compare the intervention, and outcome are the consequences of the intervention in which we are interested. Now, in the intervention type of studies, you will get this PICO. You will not always get the PICO. When you are doing a systematic review on observational studies, you will only find population and outcomes. There won't be INC in that. Okay, when you're doing analytical type of studies, case when you're including case control and cohort studies mostly, you will have PECO instead of PICO, that is PECO, where E stands for exposure. Instead of intervention, you will be having exposure over there. So I have given some examples here. We can go through the examples and see in the question how these questions are framed, where in each and every question there is a PICO. The population is defined, intervention is there, comparison is there, and also the outcome is there. So this is the basic step. The first and the most important step is to identify the question, and the next steps, if they are slightly incorrect also, still your systematic review will be successful. But if your first step goes wrong, if you frame a wrong question, then even if you do all the remaining steps correctly, your systematic review will be a failure. So this is the most important step. So here, this is an example of a therapy or prevention type of a question. What is the effectiveness of antibiotics in preventing complications such as post-operative infections after third molar extractions? So this is a focused question. Here, the population will be patients undergoing third molar extractions. Intervention will be antibiotic prophylaxis. Comparison, no prophylaxis. And outcome will be alveolar osteitis and surgical wound infection. This is example 2 for harm or etiology type of question. Does giving toddlers milk instead of water to drink at night cause caries? Population is toddlers, intervention drinking milk at night, comparison drinking water at night, and outcome is dental caries. So third example is of diagnosis. How useful is a periapical radiograph in detecting interproximal caries as compared to bite-wing radiograph? So here the population group is patients suspected of having interproximal caries. Intervention will be periapical radiograph. Comparison will be bite-wing radiograph, and the outcome will be diagnostic. We'll see by means of true positive, true negative, false positive, and false negative findings. The fourth example, the nature of the question here is prognosis. Are patients with diabetes at higher risk of experiencing complications after third molar extractions than are patients without diabetes? So here the population group is patients undergoing third molar extractions. Intervention is presence of diabetes, and outcome will be pain, swelling, trismus, and post-operative infections. I hope everybody is understanding this. So we'll move to the next step, that is focused questions, unfocused questions, and focused questions. You will always, when you start a systematic review, you will get a question in your mind which is going to be unfocused. You want to study something novel and something different. You will have a question in your mind, but you need to translate or convert that unfocused question into a focused question. So again, I'm giving you a few more examples how it is to be done. So I have this doubt in my mind: how effective are occlusal splints? Now, to make it a first question, definitely I need to do a background search first. Okay, you have built your team first, you have formed a team first, you have a subject expert here. Definitely I'll consider taking an orthodontist in my team for this. Okay, and or a oral medicine person, or a person who is working in a specialist of TMJ disorders. Okay, so I may have them in my team, and then I will do a lot of background search. We'll keep a meeting, and then we'll try to translate this into a focused question. So now, if you see this, this is a more focused question. Are canine guided occlusal splints more effective than non-occluding splints in reducing temporomandibular pain in middle-aged females? So here you are having population as your middle-aged females who are having temporomandibular joint pain. Canine guided occlusal splints are your intervention, and your comparative group is non-occluding splints. Okay, and your outcome is pain reduction. Okay, so this is a focused question. Another example is, does chlorhexidine cure gingivitis? Okay. So does twice daily chlorhexidine rinse in young adults reduce the severity of gingivitis compared to personal oral hygiene alone? Okay, so now coming to the broad and narrow question that I said earlier, I'll be coming to that. Now, uh, how do you decide to keep a broad or a narrow question? Now, first thing is that when you have to make it clear that there is a difference between a focused question and narrow question. Focused question means it will have the PICO, whereas narrow and broad means uh, how do you decide to narrow down your question? Now, in this example, if you see, I have mentioned twice daily chlorhexidine rinse in young adults. Okay, so I have restricted here to young adults only. Okay, now if I want to further narrow down this question, so I will add concentrations over here in my focused question. I may take 0.12%, I may take 0.2%, I may take 0.1%, and there is also a concentration of 2%. So this is just for example purpose. So if I put that percentage over here, my search will be further narrowed down. My focused question will be narrowed down. Now, how do you narrow it down? Why to narrow it down? So the first thing is, again, when you form a question, you always have to uh, keep in mind the finer criteria. Okay, it has to be feasible. The first thing is it has to be feasible when you're conducting a systematic review. If there is lots and lots of literature available, you can definitely narrow down your question. Otherwise, you'll end up having thousands of articles, okay, and it will be very difficult for you. So the feasibility also has to be kept in mind. So here you can narrow down the question. You are doing something novel, something new. There are very few studies. So in that case, we will not narrow it down. We do a background search. When we do a background search, we see various different types of studies. Suppose we have got only 10 articles for that novel study. Okay. So now in that 10 articles, if I go to see and use a specific concentration, I will end up having only two articles. So in that case, when you are having very few articles, you try to keep your question broad. So this can only be done after doing a background search. Without background search or without the expert knowledge, you cannot frame a focused question. Yeah. The next example, does fiber optic transillumination detect dental caries? How does fiber optic transillumination compared to wide field radiography in the detection of early interproximal dental caries in adults? So how does it compare? So again here we are having population, intervention, comparison, and the outcome. All the four things are there in this question. Does flossing prevent periodontitis? Does daily patient flossing reduce the incidence of periodontal bone loss in healthy adults compared to daily patient brushing only? How well does behavioral therapy treat temporomandibular joint disorder? Does behavioral therapy reduce temporomandibular pain more effectively than non-steroidal anti-inflammatory medication? Okay, again here we see that every question that we have framed has a PICO. What is the best treatment for pericoronitis? Which is more effective in relieving the symptoms of third molar pericoronitis? Saline irrigation or systemic antibiotic? Yeah. So we saw how we have converted these unfocused questions into focused questions. Now there is another way of doing that. As I've told you, to frame a question, you can take a session with the subject expert, and then suppose you have something in your mind, like how to start framing the question. The first method that I've told you, you keep on looking at articles, various systematic reviews, and automatically you just translate their question and add your intervention and comparison group. But what if you want to do something different from the base, your own thing? Then this is one example or a method that I can explain you how it has to be done. So first you have to classify, as I've told you, you have to classify the question and all the different types of question for that particular disease. So I've taken an example of malocclusion over here. Okay. So when you see a patient of malocclusion, now what comes to your mind is, what is the cause of this condition? Is it because of the environmental exposure or because of heredity? So this is the etiology type of question. What is the likelihood of getting worse or getting better if you do not treat this? So if this condition is left untreated, what worst would happen to the patient? And suppose if you are giving some treatment, like we all know braces. Now you add braces to that patient, you give braces to that patient, then you would like to know the prognosis. Okay. Then what are the benefits of the orthodontic appliances? So you started giving a therapy to the patient. Now you would like to know the benefits and the harms of those orthodontic appliances. Now here also there would be some harm of giving orthodontic appliances if it is given to school children. It may have a psychological impact on them. They go to the school with braces. Some people, some children might tease them. So what would you do for that? So maybe you may go for lingual orthodontics in that case, and then potential difference in outcome if the patient is treated earlier rather than later. So that this is a screening type of question that will come across. Maybe if you go to a school and you do the screening for maximum screening in school children for malocclusion, then maybe you would be able to reduce the problem of malocclusion among the school children. And then one more example over here would be how after giving braces, how much change, how much change is desired? Like how much change do you expect after giving the braces? So all these questions come to your mind, and keeping in mind these questions, this framework, you can frame your own question along with subject expert and background search. Now coming to the inclusion and exclusion criteria. All the inclusion and exclusion criteria must be documented in the method section, and the selected criteria should logically proceed from the focused question. It should define the population, intervention, uh, exposition or the exposure, the comparisons, and the study design of interest. Now, your inclusion and exclusion criteria, the inclusion criteria is very, very important. Based on your inclusion criteria, you will be able to narrow down your search. Okay. You will be able to narrow down the number of articles in your study, and your inclusion criteria will include all the four components again. The PICO that is there in the question will be there in your inclusion criteria. So the first thing is your population. Here you need to define the condition or the disease. Suppose you are looking for dental caries. So yeah, here you need to define dental caries. You need to give some operational definition over here. Okay. Or maybe you can use the same definition what the authors have used in the original study designs, which you are going to extract for your systematic review. So that all depends on the reviewer, what you want to do. Okay. And then you need to mention the population and setting of interest. Maybe it may be among the school children. Okay, it may be in outpatient department patients, or OPD patients, in then it may be in hospitalized patients, it may be in a dental college. So that setting of interest has to be mentioned in the inclusion criteria. Then intervention. In intervention, timing of the exposure has to be mentioned, route of administration has to be mentioned, what intervention you're giving. So everything about that intervention has to be elaborated in your inclusion criteria. Okay. The dose intensity has to be mentioned, duration of exposure or therapy. Now, in this inclusion criteria, you can narrow or broaden your question. It is up to you. Here, you will be able to narrow down your search. If you, the chlorhexidine example that we have seen earlier, as I've told you, the concentrations. If I add the concentrations, I want to include only studies having include studies where only 2% concentration of chlorhexidine solution has been used, or only 0.12% of chlorhexidine solution has been used. So definitely I am going to narrow down. The other concentrations are automatically excluded from our study. Okay. Then one more important thing here is when the studies are done in the methodology, in the original study, you would have seen most of the times the training and calibration of the operator is mentioned. So all those things need to be mentioned. You will include only studies where they have mentioned about the training, or it may be up to you. Again, if there are very few studies, you get only 8 to 10 studies for your focused question, then you need not mention that. You will mention that I will include all the studies, all the articles will be included in the systematic review, whether the procedure has been done by any operator. Okay, without training, with training, anything that you then, this is how you broaden and you narrow the question. There is a example that I've given in the next slides. So once you go through the slides, everything will be clear. Then the next thing is comparison. So apart from PICO, as I told you, you have mentioned the population in your inclusion criteria. You have mentioned the inclusion, the intervention thing in your inclusion criteria. That is, you're elaborating everything. You're elaborating your P, you're elaborating your I, you're elaborating your comparison. You have to mention whether in comparison, are you only looking for articles that have taken only placebo, or they have taken any gold standard, or they have taken patients with no treatment at all. Okay, now if it is suppose a epidemiological type of systematic review where instead of intervention you are only including case control or cohort studies, so there you need to mention uh, no exposure about, elaborate about no exposure group also. Okay, and from where are you going to extract the non cases? Okay, like in case control, you have taken the cases, and what about the controls? Are you going to take them from hospitals or neighborhoods, etc.? So these things have to be elaborated in your inclusion criteria. Now, this again is a very important thing, outcomes. So in the Cochrane collaboration, they have mentioned these 5 elements have to be considered when you uh, are writing about the outcomes in your inclusion criteria. The first thing is your domain. Okay, so your domain is the name of the outcome. It can be dental caries. You want to see whether the pain has increased or reduced. Okay, so that is the domain. Then specific measurements. How are you going to assess it? How are you going to assess dental caries? So you need to write down the specific measurements with the help of DMFT, or if you are assessing pain, with the help of VAS scale, visual analog scale, and then specific metrics. That is the format of how the outcome data will be analyzed. That is from how is it going to change from baseline at the different time points. Again, specific metrics and time points are correlated. Okay, at what time intervals are you going to do the follow-up? 3 months, 6 months, 1 year? All those things have to be mentioned in your inclusion criteria in the outcomes section. Okay, and methods of aggregation, how the data will be summarized. Are you going to take the median or the mean? Okay, So now this is mostly in the meta-analysis, the methods of aggregation. In systematic review, you need not consider this. Okay, now apart from PICO, some people also use PICOTS in their systematic review. Now what is this T and S? In some of the studies, I told you about the harm and the prognosis, that you are going to look for success rate of a particular thing or success rate of the implant placement. Then in that case, you need to have a follow-up. Okay, suppose you or endodontic surgery. Suppose you have done a bisektomy and you want to see the bone formation. So in that, you will need to have a specific follow-up period, minimum 3 months, 6 months, or maybe after 1 year and 2 years to see the healing of that bone loss that has occurred over there. So it needs to have a minimum follow-up. So you can mention that timing over there. Apart from population, intervention, comparison, and outcome, you can add your timing. That is, the minimum follow-up should be of 6 months. So we'll only include articles where the follow-up is minimum of 6 months. Okay, we will not include articles where the follow-up is of 1 year. Okay, and then the last thing is S, that is your setting. As I told you, there are different settings. Some studies are only done among school children. Some studies are only done among hospitalized patients. So that setting can be mentioned. So that is your PICOTS. So now this is one example how to start with the protocol for systematic review. So ideally, you have to set your protocol on the Prospero website, which will be demonstrated in the last lectures. I think on the 5th day and the 6th day, how you go about it, how you write your protocol for systematic review. But before writing the protocol of systematic review on Prospero, it is always advisable. I would advise you to just start with the title of your systematic review first. After the title, you go for what is your focused question, what is the PICO of your systematic review, and what are the inclusion and exclusion criteria. Only by doing this, you complete 50% of your protocol for systematic review. Yeah. So this is the example. Title is Retention of Flowable Composite compared with pit and fissure sealants in permanent molars of school children. So here, as you can see, the title has the PICO. Okay, and the title has it has to be in the form of statement always. It cannot be a conclusion, it cannot be conclusive, or it cannot be in the form of a question. Okay, and you always have to add systematic review at the end, or a systematic review of in the beginning. That has to be mentioned in your title. Now coming to the focused question. What is the difference in the retention rate of pit and fissure sealants and flowable composites in permanent molars of school children? So your focused question and your title, they have to relate to each other. Also your PICO has to relate, and your inclusion criteria. So all these four things are going in hand to hand. Okay. So now objective of the study is to evaluate the difference in the retention of pit and fissure sealants and flowable composites in permanent molars of school children. So this is the PICO. P is school children who have received pit and fissure sealants or flowable composites on permanent molars. Intervention would be flowable composites. Comparison would be pit and fissure sealants. Now here you need to mention uh, in flowable composites, when you are writing on Prospero, again, the best thing would be you mention the brand names also. Or else, if you're not sure of the brand names and you want to broaden your search, or you're only looking for specific brands, then you have to mention the brand names. But you want to include all the flowable composites, then you can write flowable composites that are available, all the flowable composites that are available in the market. Okay, so that will include all the flowable composite articles. Again, in comparison, you have to mention the types of pit and fissure sealants, which one you are interested, which one you are looking for, the types of pit and fissure sealants. And again, if you can, write down the brand names. In outcome, you mention the we are looking for retention rates. So there is one Simonson's criteria to to look for the retention rates, but some studies may have not followed these criteria. So we can, to broaden our search again, to broaden our systematic review, the focused question we can add there, or any other methods used to evaluate. Now this all depends on your background search. When you have done a background search, if suppose you have got only like 10 articles who have compared flowable composites and pit and Fisher sealants, or very few articles. And in that also, if I just write Simonson's criteria, I may end up having only 2 3 articles. So here I have to broaden the search, and I have to mention or any other methods used to evaluate. Now in inclusion criteria, we have to mention about the population, intervention, comparison, and outcome. Okay, but the first point to be mentioned here is the type of study design that we are going to include in our systematic review. So the first thing is articles reporting parallel and split mouth clinical trials, randomized control trials, non-randomized control trials will be included. Studies on permanent teeth with no clinically detectable caries. Studies in which sealants or flowable composites were placed on occlusal surface of the permanent posteriors for the purpose of preventing caries, regardless who did the application. As we have discussed in the earlier slides, in the intervention, uh, I have mentioned here, regardless of who did the application. Okay, the application must have been on sound surfaces. Studies in which lesions were diagnosed by visual or tactile assessment or by radiographs. Articles with at least 12-month follow-up reporting information about school children who received pit and Fisher sealant and flowable composite for prevention of dental caries in permanent molars. Studies that use Simonson criteria or any other methods to detect the retention. Articles reporting the outcomes in terms of retention rates in permanent molars of school children, and articles in English language or other language where English translation is possible. Articles from January 2010 to December 2020. Now again here, the duration. Now again, this depends upon the author. Now here, uh, I would suggest you, if suppose you, we'll take the same example of flowable composites. This is just for the sake of example I'm telling you. Now, if flowable composites have come in the market from 2010, so it is always advisable you start your search from 2010. Okay, sometimes this thing is there in the market since ages. You may have articles from 1990, so that means still you need not, agar market mein aaya, that does not mean you have to start your search from 1990 itself. That again depends upon you. When you do a background search, okay, after doing the background search, you will come to know that some of the things are outdated in that. Some of the concentration, some of the doses, all are outdated, and some new things have come up. So that all depends upon you, how much you want to narrow it down to. Okay, but the last thing that we have mentioned to December 2020 is very, very important.